Good afternoon. Welcome to Facebook Live with the Mobile County Health Department. It's May 22nd. I'm Dr. Laura Cepeda. I'm the Chief Medical Officer for the Health Department. Dr. Murphy couldn't be here today, so I'm subbing for her. A couple of announcements. For the Family Health Division of the Health Department, we have now resumed clinical operations at all of our sites throughout the county, and we do have COVID-19 testing available at all of these sites. No out-of-pocket expense, and this is for all of our existing patients, as well as if you aren't an existing patient, you're welcome to come to our sites. But you do need to have an appointment before you come, so please call 251-690-8889 to schedule for either of those services before coming. That one number, you'll be directed to whichever site is most convenient for you, and that's 251-690-8889. Except for Monday and Honor of Memorial Day, we will be closed to the public at those sites. Dashboard updates for today. The numbers for Mobile County. Today we have 1,889 cases today. There we go. That's an increase of 56 cases, I believe, from yesterday. There are 216 hospitalized and 107 deaths. The ADPH dashboard has begun adding presumed recoveries to their COVID-19 dashboard, and that is something to just want to explain what that means, because we have had recovered cases on our dashboard for a while, and theirs means something quite a bit different from ours does. Their definition, of recovered, presumed recovered, means just that it's been 14 days or more since their case tested positive if they were not hospitalized, or it's been 32 days or more since they tested positive if they were hospitalized, or if hospitalization was unknown, and all deaths are excluded from this case. In our dashboard, our recovered number actually means that we have been able to contact them directly and confirm that they have actually recovered. So those numbers are very different percentage-wise for our cases and the ADPH. So that's why you'll see such a different percentage of cases. Otherwise, comparing just our percentage of cases, they look very similar in terms of age groups, breakdown by gender, and by race, and percentage of even things like healthcare workers. We do see, like, for our COVID-19 disease, healthcare workers make up 15%, in state that's 13%. So much of what we see in Mobile County is reflected in throughout the state. So just interesting if you want to compare the two. We will begin consolidating we've been putting out 2 dashboards, and the documents will begin consolidating that into one, and just begin putting it out during the weekdays, and that begins on next Tuesday as well. Let's see. Would you like to we have some information that's come out from WIC. Would you like to come present that now? Okay. There's been an update from the FDA. I'll let you go.
Good afternoon, everyone. I'm Marshallette Patrick. I am an employee today representing Mobile County Health Department, WIC's department. Just a couple of updates to let you all know that we have received a message that we will be extending our phone interviews and the phone distribution until June the 30th. So that's a new update. So we're not actually seeing any face-to-face participants again as of right now. We are going to extend this until June the 30th. If there are any more updates, but what we'll do after June 30th, we will be sure to notify everyone. Also, if you have an appointment, be sure to continue to call your local WIC department, your local WIC office. Or if you have any questions, you can call the main number at 690-8829, or you can call the Teen Center, which is the one located on Cox Street, that's right across from USA Children's and Women's Hospital, and that number is 690-8824. But continue to call your local office to schedule your appointments. Also, just remember that before you have your appointment, you have to fax us in or email us those documents that we need. You'll still need the same documents that you're required to have for your regular appointments as if we were still seeing you face to face in the office. So you will still need to have those documents, and you're gonna email them to wicmchd@mchd.org. Those documents that we will need if you are doing a 6-month or a research will be your proof of ID, it's going to be your proof of residency, and your proof of income. Your proof of income, again, can also be your Medicaid card will suffice, or if you have something other, an unemployment letter, food stamp letter, anything like that will suffice for your proof of income. Again, you can call us until June the 30th. We're going to be distributing over the phone. That's the only new update that we have for right now. Again, if you have any questions, if you have milk that you have to pick up, special formula that needs to be picked up, you're going to pick that up at the Teen Center, which is located on Cox Street, right across from USA Children's and Women's Hospital. And that's the only other changes and updates we have. Anything else, we will be sure to let you know. Thank you.
Thank you so much for that. Okay. One thing that we want to just bring to light in this pandemic is so many things have transitioned to either telemedicine or just been put on hold. That includes a lot of children getting their vaccines, and there was just a recent study that showed that children's vaccination rates have really dropped, in some cases below 50%. Please, now that things have really started to open back up, it's so important to get your children back in to get their vaccines, because the last thing that you need is an outbreak of a vaccine preventable illness in the time of a pandemic. Most offices are having appointments for these types of visits, even if they're restricting others. If you're unable to get those, again, please call at any of our clinics and we will accommodate you as we need to. That number is 251-690-8889. We're also going into a holiday weekend. Please urge you to be very careful. The restrictions have begun to loosen, but the COVID-19 disease is still out there, so please practice social distancing, wear your face covering when you'll be around members who aren't of your own family, and please be safe. Also, we're heading into hurricane season, and this year we know that there will be restrictions on shelters in terms of capacity because of the distancing that will be necessary. So it's more important than ever to have a plan for your family, and if possible to have that plan that would not involve needing to use the shelter. So now's the time before it's necessary to need it, to start making that plan. So probably this year more than ever, start making your plan before you need it, so that when the hurricane or tropical storm comes, you are ready to put it into action. So, okay. I think with that, able to get to some questions from the media. First question is, has Mobile County had a confirmed case of what's called multi-system inflammatory syndrome in children associated with COVID-19? And the answer is no, there have been no cases in Mobile County that meet all the CDC guidelines for this syndrome. So to meet the definition of this, it needs to be someone who's less than 21 with fever, with evidence of inflammation by lab guidelines, and a severe illness that requires hospitalization with evidence of at least 2 organs that are inflamed. And that can be heart or lungs, kidneys, and no other evidence for why they might have this going on, so not any other source of infection that they can find. And then they need to either test positive by PCR for ongoing COVID-19 infection, or test positive by antibody test for a previous infection with COVID-19. So you have to meet all those criteria in order to meet the guidelines for this. It's called MISC, or multi-system inflammatory syndrome in children. This is similar to, it looks clinically very much like something called Kawasaki syndrome, which has been thought to be a inflammatory syndrome that is most likely related to post-infectious sequelae of something else. So it may be that this is something that is either the same thing because of COVID-19, or that we're just seeing it at the same time. But it's been described a lot in places that have a very high disease burden, like New York. There are a lot of reports coming out of it. But so far, Mobile County has not seen a case that meets all of those criteria. The next part is pediatric cases in Mobile continue to rise. I said 0 to 4 years, and the next age group that's reported by the health department encompasses the age group of 5 to 24. Given the rise in concerns over this disease, the MIS, the multi-system inflammatory syndrome, will Mobile County Health Department be dividing the age group into smaller groups for reporting purposes? So although we have seen the cases in that 0 to 4 age group increase, they've actually increased proportionately with all the other cases. So they've stayed about in the 1% of all of our reported cases so far. And if we were to see something in either that 0 to 4 or the 5 to 24 age group, age group range change dramatically, or be something really surprising happen, then we would of course want to take a deeper dive into that and try to get an explanation for what's going on, and absolutely consider breaking that information, that age range down further. But at this point, it's stayed pretty proportionate, even though the cases have risen. All the cases have risen, just as it's gotten higher throughout the county. Okay, the next question is, Governor Ivey announced a partnership with Apple and Google regarding contact tracing application for smartphones. Does the health department have any information about the apps that will be used, and are there concerns about them? So there are at least a couple different kinds of apps that are being proposed and being used. There are symptom trackers that are currently being used, and then there's contact tracking, and both of those have potential for a lot of benefit. And in terms of downsides for both of them, I mean, there's nothing that's perfect, because they both rely on people as the end users. I mean, symptom trackers, you gotta put your symptoms in, of course. So I think there are some places that are requiring that. Some schools that are requiring the use of the symptom tracker for you to be enrolled. But in terms of the contact tracing, that relies on more of that Bluetooth technology that was mentioned, where that the success of that, if everything else goes well, really depends on the percentage of people that are using it. So, you know, if one person is using that app and it's a person who tests positive, but nobody else is using it, then obviously it's not going to be much good. So, you know, the symptom trackers are dependent on the person using them, and the contact tracing apps would be dependent on, you know, a majority of people using them. And at this point, those at least are, you know, more elective for use. But it remains to be seen how that unfolds in the future in terms of the reliability. I mean, it's all unfolding in real time, so I guess we'll see. We're all watching this together. Okay, next question. At a restaurant with covered outdoor patio food service, there was a vaping smoker. They noticed the cloud produced was quite large, and I wonder if the virus could spread this way. It seemed that it should be prohibited at restaurants because it surely covered an area of more than 6 feet as it drifted. We'd like to know where the health department stands on this activity, and it made them uncomfortable and they left the establishment. So where the health department stands on this activity, the health department definitely does not, you know, encourage any vaping or smoking or anything that is known to have a negative health benefit. So that is absolutely not something that we encourage you to do. You know, at this point, that is something that's allowed. What the vaping cloud lets you do is really visualize where that that vapor cloud is, but that's the vapor cloud that can be there regardless of the vaping, actually. So that's really more of a visualization tool of those droplets, more so than it is making it worse. So that I agree that when you see that, it's pretty unnerving, and I don't blame you for getting up and leaving. And I think, you know, with the that's exactly why it's encouraged for people to have face coverings on, to prevent exactly those sorts of droplets from spreading. So I think that, you know, personally, you probably made the right decision to keep yourself from being at risk in that situation. So are we involved in communication with anyone involved in the UAB Symptom Tracker project? Yes, we are. Do we look at how their information compares to known cases? Not yet. It's an ongoing project in the early stages. That's certainly something that we'll continue to look at with them as it develops, but it's in the very early stages. So it'll be exciting to watch it develop and see how accurate it is. One thing that we have learned throughout this course, though, is that there are many more people with this that are asymptomatic than it was expected. So we'll see how symptoms are predictive, if they are predictive, and maybe there are more subtle symptoms that the symptom tracker can detect that we'll see how it plays out. But it's exciting to see if that becomes helpful as we go. Okay, the next. The 14-day decline order has been ignored. Why? I guess that's all that was sent in. That was a Facebook comment question. I'm guessing this is referring to the White House gating criteria. So that was not an order. So the only orders for the state of Alabama come from the health officer and the governor. And so they make those decisions with the task force. It's a group that makes that decision. So the CDC has guidelines and recommendations. The White House has guidelines and recommendations, but those are not orders. Those are given as guidelines with the understanding that every state, every area has its own unique set of circumstances. So that's the decision that the governor and the health officer made at this point in time for our state. So I think they trust everyone to look out for their own best interests and really use their safety features to keep themselves safe. So wear your face protection, wash your hands, and safer at home is still the take home. Some people feel okay going out and some people really don't, and you need to really trust that. If you need to stay home, stay home. There's no doubt about that, and I think the governor was very, very clear on that, and so was Dr. Harris. So please don't mistake this for everything is fine. Everything is not fine, and we still need to be very safe and protect ourselves. We have been fortunate to have plenty of capability within our community, but this is still a very active disease and it continues to increase in numbers. So please be safe over the holiday weekend, and remember what this holiday is about, our soldiers who have died defending us. And thank you all for your time here today.